Hello, my name is Letitia Opferman, and I am in the RN BSN program, currently enrolled in the NUR 3805 Roll to Scope course. I'm submitting this video in regards to our policy PowerPoint presentation, and I chose Nurse Staffing Standards for Hospital Patient Safety and the Quality Care Act of 2019. But let let you know that this act has been out for over a decade. It constantly gets reviewed by Congress, and they make changes and tweaks. But that's normal because society changes constantly. So therefore, we got to keep up with society. I completely am grateful for this act. I have noticed changes along the years, so I do believe that it's working. It's just moving very slowly. This bill was introduced into the House by a congresswoman that's a Republican by the name of Jan Schakowsky, and then the senator, which is Democratic, was with Sherrod Brown, is the senator. But they actually amended the Public Health Service Act with this particular Patient Safety Act. I believe that this act was implemented to minimize the amount of nursing errors, patient deaths, and things that did not have to happen that happened, but it usually happened because why? Staffing was out of control. Staffing is a huge issue everywhere I've been so far in this profession. Staffing always seems to be an issue, so that is why I did choose this particular topic to discuss. I do feel that recommendations for this bill, me personally, I think that the research and the data that they collect to make the changes, that they come from individuals such as myself and others in the healthcare industry that are affected by staffing. I think that's the best way to gather your information and to make changes. I feel like it should be done at least every year or possibly more. And fines, I feel like if fines were added to this, forcing organizations to comply with what the government standards have submitted to us in society, and also give these companies that are not able to comply some kind of tool, some kind of aid to help them from failing further or from continuously failing. Those are some of the things that I think that should be implemented into this bill along the way. I do feel that it's a good thing because it can improve our patient outcomes. It stops us from being burned out, for crying out loud. One nurse with 10 to 13 patients, you can't give good care. We all know this. It's just not going to work. But it will help prevent any kind of adverse events and keep us long term. That's a big problem. You can't keep seasoned nurses because it just doesn't work for them. It's just too chaotic. You can't stay. I think I've covered it all. And I said why the bill was implemented. So I hope you enjoy my PowerPoint. Let me know anything that I may have failed on and the things that I can do better. I appreciate your course thus far, and I hope you have a great day. Thanks, Professor Sampson.